Hi guys, it's Adam here. I'm an orthopaedic surgeon. If you're about to have joint replacement surgery or any type of operation, you probably have a bunch of questions about the wound. Today I'm going to run through the top 3 questions I get asked in clinic.
Number 1. What will you use to close the wound, and is there any difference between stitches and surgical staples? Number 2. When can I take off the dressings? Number 3. When can I get it wet?
In another video, I'll be covering things that can go wrong with wound healing after an operation and things that you should watch out for. So if you find this helpful, please do remember to hit subscribe.
As always, this video is for general information only, and you should always follow the wound care instructions given to you by your surgeon and seek medical advice if you are worried. So, firstly, how is a wound closed? When a knee or hip replacement is done, there are lots of different structures the surgeon goes through to get down to the bone and put the implants in place. These different internal layers need to be carefully closed using stitches, usually ones that will completely dissolve over time.
When we talk about the wound, what most people mean is the skin, because all the internal layers below the skin would have been closed by your surgeon, and hopefully you'll never see those. There are 3 main ways that the skin can be closed.
The first is with skin staples. These are small metal clips that work like normal staples and pull the edges of the skin together. They need to be removed usually after around 2 weeks when the skin has healed. The second is with non-absorbable stitches, which again need to be taken out after wound healing has happened. And the third is some kind of dissolvable stitch that runs under the skin. Sometimes surgeons use steri strips or skin glue over the top of this, or they may leave the ends of the suture on the outside of the wound, and these need to be trimmed, but the suture itself is dissolvable. Different surgeons close the skin in different ways, and there's no right or wrong way to do it, but it's really important you check with your surgeon what they'll be using, because if it's something non-dissolvable, then you need someone to remove the stitches or clips when the wound has healed. Which brings us on to the next point. When can the dressing be removed? Once the skin is closed, you will usually have a sticky dressing on top of it. Now, this is put on in theatre, which is a clean, sterile environment, so most surgeons will want you to leave this sticky dressing on until the wound has healed, usually for around 2 weeks, because if you keep changing it, all it does is expose the wound to the outside environment and increases the risk of infection. If the sticky dressing soaks through with blood, starts peeling off, or is damaged, then your surgeon might well want to change it sooner, but unless they advise you to, it's usually best to leave it on, and you can check before you leave hospital what to do and where you should go if you're worried about the dressing. Over the top of this dressing, the surgeon will then often put a layer of padding or wool and a lightweight bandage. Most of the time, your surgeon will advise you can remove these outer layers after a few days, unless there's a specific reason they want them to remain on for longer. After you've been advised the dressing can come off, usually at around the 2 week mark, the wound should have healed, so the staples or sutures can be taken out. Where the staples are removed, there are often little holes, and I usually tell people to leave a dressing on for another 24 to 48 hours before getting the wound wet. But again, just check with the person who is looking at the wound whether or not they're happy for you to get it wet and when.
If you notice any bleeding or discharge or anything else concerning about the wound, it's definitely worth seeing your surgeon or another physician before 2 weeks. However, even if the dressing is dry, I'd still recommend that an appropriately qualified person looks at the wound at 2 weeks just to make sure it's safe to remove the sutures or the staples. And also at that stage, they will be able to pick up if there are any worrying features of the wound, for example, related to infection.
The final question is, when can I get the wound wet? In theory, many of the sticky dressings I spoke about earlier are waterproof, but you just need to be really careful because if there's a small area where it's not sealed or cracked, the whole dressing can end up getting soaked. So most surgeons advise to avoid getting the sticky dressing wet for a couple of weeks. You can put bags over the area, especially around the knee, but doing this around the hip is more tricky. Another option is to shower with the affected leg outside so it stays dry. So there are ways around it, but the main thing is to try and keep the dressing itself dry. Also, just be really careful not to slip in the shower or bath if you do this. After your surgery, you might well struggle to weight bear on that side because of the pain, so you're at much greater risk of falling, especially on a wet floor. So it's a good idea to get someone else to help you when possible.